Hello, friends. I hope you're all doing well. And first, I want to wish all my Muslim brothers around the world a Ramadan Kareem. Um, I haven't had any videos for the last few days, for last few weeks, might be because I had quite a bad viral illness. I think you can actually see that from my croaky voice. This video will be short. It will be like might be a summary of what I've said last time about pain management. And this video, I will concentrate on management of severe pain because that's the one which actually matters more, obviously. Just to summarize, it is very important to remember that pain is, for me, is totally subjective. Up to now, there is no agreed measure, objective measure for pain. It is just you have to go with what the patient tells you, according to a numerical rating scale. And after you actually assess the pain by asking the patient, then you have to treat that accordingly. And we say that mild pain is from 1 to 3, moderate pain from 4 to 7, and severe pain from 8 to 10. Mild and moderate pain, we said we can actually treat them mild by paracetamol, moderate by weak narcotic or NSAIDs or IV paracetamol. In this video, I'm going to concentrate on severe pain. It's not nice at all to have severe pain. It's a terrible thing. Now, when the patient comes with severe pain, he wants his pain to be killed or to be treated as quickly as possible, because 1 minute for a patient in severe pain feels like an hour or more. So that's very important to have the pain removed very, very quickly. You have to use a safe agent, okay? You have to have something which is not very expensive, hopefully, and there's something which you can actually monitor, and you know the side effects of it, if any. Now, as I said last time, severe pain, you have to use narcotics. Full stop. You have to use narcotics. That's all. You don't start with say something else, and he said if it doesn't work, then I give narcotics. It's the other way around. You give narcotics first, and then you can add IV paracetamol or something else if the pain is not completely treated. Your aim is that the patient should not have, patient with severe pain should not have, after treatment, should not have pain scale more than 3. It should be like 1 to 3, okay? But that's which is mild pain. Now, to treat the pain quickly, the quickest route for pain management is intravenously. So quickly you put an IV line up. I'm not going to talk about history and all that stuff. I'm just talking about the pain management. Put an IV, take 10 milligrams of morphine or 100 micrograms of fentanyl, dilute that in 10 mils of water, okay? Now, you give these medicines IV, either or, of course. Don't give both of them, just either or. Say morphine. So we give like 2-3 milligrams, 2-3 mils from the diluted morphine, IV. Wait for a little bit. If the patient is still moaning and groaning, then you give increments of one mil every few minutes, okay? Now, a time will come when the patient will tell you that the pain is okay, and of course, he said that in response to your question. What is your pain scale now? Again, you repeat from 0 to 10 and so on. And if he says the pain is like 5, so you give a little bit more. And sometimes you ask the patient, do you want me to give you more medicine? Some patients will say, no, that's fine, that's okay. Because they have very severe pain. If it comes down to 5, they're happy with that. Now, the rest of the stuff, the rest of the morphine, you just keep beside the patient, okay? And of course, the patient will be monitored and so on. So after this happens, then you go and do something else, but you come back in 5 minutes or so, or you ask the nurse to come and see the patient for 2 things. To ask the patient what is his pain scale now. If it is satisfactory, like 3, 4, something like that, and the patient is happy, that's fine. The other reason is to make sure that his oxygen saturation is okay, he's breathing fine, and so on, and he's responsive, and so on and so forth. So this is very important. If in case that the patient is still having pain, then you give increments until you get the total dose, which is 10 milligrams of morphine or 100 micrograms of fentanyl. I myself, sometimes I don't actually hesitate to give more of the morphine, 2, 3, 4 milligrams. I've done 18 milligrams before. That's no big deal, because some people say, oh, how could you give that big dose? That's no big deal, because the patient in the hospital under your supervision, monitored and so on. So that's no big problem. Sometimes it might be advisable to combine narcotic with, say, IV paracetamol, which is called Perfalgan, I think, or even IV NSAIDs, IV Voltaren. And your main purpose of this is actually to kill the pain, because if you don't kill the pain, then you are actually wasting your time, and the patient won't be happy. The patient needs this pain to be killed, and quickly and effectively as well. So this is severe pain. If there is some complications, like the patient stop breathing or saturation is low, then there is an antidote. You can oxygenate them and so on and so forth. So be no problem there. But your main issue has been done, that the patient now is happy, comfortable, and so on. And I think the main purpose of emergency departments for me is twofold: to keep the patient alive and to keep patient pain-free. That's the main 2 things you do. Diagnosis, other things are okay. And of course, the other purpose is that to know how to where the patient will go after he sees you. Does he go admitted, be referred, go home, whatever. So this is a big decision for emergency physicians to make, because they are the ones who are actually going to decide the fate of the patient after treatment. Okay, I will stop here, and I wish you all the best. And please comment on the video, or do the like and stuff like that. And until next time, in another video, I wish you all the best, and goodbye, cheerio, and hasta luego.